This is WGNS Action Line. WGNS Action Line. Now your host, Scott Walker.
In studio with us this morning, we have local eye doctor, Dr. Craig McCabe of McCabe Vision Center. How are you this morning?
Hey, I'm doing great. I hope everybody out there is doing well. I hope they enjoyed this beautiful weather we're having. I hope everybody's happy. It looks like the war has ended, and they've returned most of the hostages, and this is a good Monday starting out the week.
It is, and man, that temperature out there feels perfect right now.
Oh, it's nice, and the humidity has dropped. I think that's one of the biggest things that people have enjoyed. You get to get out in your yard and, man, get it ready for winter, which is a lot of work, at least for me.
It is. Have you got a lot of flowers, shrubs, all that stuff?
I do. I have, I have a sweet spot for those big, pretty flowers, and I have azaleas and hydrangeas and hibiscus, and iris, and I just love them all. And they're just a lot of work, because whenever you have those, you have to weed, and you got to get all the weeds out, and you either have to do mulch, or I've got rocks, and you have to edge and mow and weed whack, and then as soon as you get done, about 4 days go past and you got to do some more. And then in the fall, you got to trim everything, and you want to put out your pre-emergent and get your house ready for winter. And boy, I'm just so glad we've got nice weather now. You can go out and work out there and hardly sweat at all.
I love it. And by the way, for the folks listening, if you have any eye-related questions for Dr. McCabe, you can text those in right now at 615-893-1450. But yeah, lots of yard work. That's always enjoyable.
And of course, we talk about it, but when you're out in the yard, you've got allergy season. And if you're out in the wind, then you can have worse issues with your dry eyes. And let's open up texting or calling, whatever you like, anything about eyes, whether it's yours or a loved one or a neighbor or what have you. Glaucoma, macular degeneration, diabetes, cataracts, glasses, contacts, red eyes, floaters. You name it, everything is fair game today. It's like when they have potpourri category on Jeopardy. It's a variety, so we can do that. But I'll tell you, I'll just start off one, I'll let you know, I got a call this morning from a patient of mine. It's also become a friend. A lot of my patients become my friends, but this was someone that doesn't go to the doctor that often, as far as the eye doctor, and they kind of have that mentality that I can see pretty well, and my eyes aren't hurting me, my eyes are doing just fine. And I think this is a false opinion that people get into commonly. And I don't know whether they just want to procrastinate, or they don't want to go see the doctor, or what have you, but for your regular doctor, you can't feel cancer. You can't feel cholesterol, which is the major killer in our country. You can't feel so many of these things until they're really bad, or the horse is out of the barn, kind of, so to speak, and it's much more difficult to treat. So if I could say one thing going into this fall, get your routine medical care, whether it be for your eyes or elsewhere on your body. Maybe you've got things that run in the family, and just make sure, if you haven't been to that doctor for a while, that you get that done, because prevention is definitely worth a pound of cure, as they say. Another patient come to me, a friend of the family, that had glaucoma and had been losing more and more vision. And boy, that glaucoma, you've got to jump on it, like so many things in medicine, to get it diagnosed early and get it treated, significantly, so that you greatly slow it down. So we have these diseases that we can cure, and then we have diseases that we can't cure yet, but we try to treat them to slow them down. And if we can slow them down, then often you don't lose much function from whatever organ that is. But with the eyes, of course, it's very important. So, this is a person who had glaucoma for a long time, but their pressures, in my opinion, were running too high, and that's why they were gradually losing vision. And if you have glaucoma, you want to make sure that your pressures stay low every visit. And chances are, if you do that, just like chances are with diabetes, if you keep your A1C very low all the time, every visit, you're not going to have problems and end organ damage, as us doctors like to say. So, get your routine care, take care of it, treat it seriously. Don't be one of these people that say, well, if I had known I would have lived this long, I would have taken better care of myself. Well, you didn't think you were going to die when you were 50. You thought you were going to live a while. So, and you still are. So get out there and make it a priority and take care of it. And, it's probably one of the best investments you can make, both for you and your family.
And here's a question for you. And again, our number is 615-893-1450. It says, this is for my husband. Why do the husbands get kind of the brunt of the negativity when it comes to stuff?
Well, I don't know if it's negativity, but
it's just caring.
At least with us old geezers like me, you're kind of like, oh, I'm a man. I'm fine. I can grit it and tough through it and gut through it, and I'll be okay. And that's just not intelligent. And sometimes a third perspective, especially from someone who really cares about you, and in this case it's the wife, is going to try to help them out. And isn't it wonderful that you have someone that loves you? And think about it that way.
That's right. Okay, so the question is, how can lifestyle choices like diet, smoking, or even screen time and drinking affect vision and long-term eye health?
Well, at least we're not out there robbing banks.
That's right. That's
so
right.
That's a positive thing there. Well, as you know, smoking is really not good for any single disease or anything, just like diabetes isn't. It damages the capillaries and the blood flow and our circulatory system, from the capillaries to the arteries to the heart. So all those things, you're adding more damage to it. But smoking, they've compared it to heroin. It's like one of the toughest addictions to beat, and it takes a village. Unless you have incredible willpower and personal mental strength to quit an addiction, it's incredibly hard. And 19 out of 20 people that try to quit smoking fail. That's how hard it is.
Wow.
So, gradually, wean yourself off and see your doctor. And there's medications, there's help groups for all these kind of things. I'm always reminded of Socrates, who once said, everything in moderation. And it's so true. If you ever have, too little of a good thing or too much of a good thing, it can cause problems. But anyways, with your eyes, smoking, of course, damages the capillaries. It is the number one, get this, it's the number one risk factor for macular degeneration. We probably all know a parent or a relative or a friend's parent or something has lost significant vision from macular degeneration. So, boy, if you've got any hint of that, you should stop that right away. Just like if you have any hint of heart disease or stroke or the other problems you can have because of smoking, lung disease. So that's that. Drinking, if it's a glass of wine or a couple of beers on a Sunday or something, that's pretty much going to be okay. So I'm not going to halt you like that. But if you're drinking every night, then you're drinking too much. And with your eyes, though, drinking or alcohol doesn't affect that much on your eyes. As you know, it hurts your liver and your heart and other things. So that's that. What were the other list?
Those were the main, the drinking, diet was one of them, and smoking.
Well, diet, it's just being overweight. Once again, there really isn't anything that being overweight is good for. And there almost isn't any disease that losing weight from being obese doesn't help in some way. It could be your back, your feet. Diabetes is a huge thing. They say, according to reports, if you lose 20% of the weight that you had when you were diagnosed with diabetes, and you can do that calculation yourself. Go ahead and do it now. Take 10% and double it, subtract it from your current weight. But that you can get off of most of your diabetic medication. And your diabetes, instead of progressing, either halts or can get some better. So, oh my gosh, I'm just a huge fan of losing weight. I think that's, in our country, that's been one of our greatest vices in our country as far as health-wise, health care, all these things. We just said that high cholesterol was the main killer in this country. It's the big C, not cancer, by the way, is cholesterol. So make sure that you get those checked. And when you get that cholesterol panel, it's the triglycerides and the LDL, the low-density lipoproteins. Those are the major bad actors in the cholesterol profile. So anyways, look at that. See your regular doctor, once a year if everything's just Jim Dandy with you. And then you'll have to go more often if you need things that need further follow-up or testing.
Well, we have a follow-up question from the same number. I'll get to this before we get to the next new question, but it's asking, what about those diet shots? I've heard those work well. Is that something that a 50-something-year-old man could do?
Yeah, absolutely. And, of course, you should talk to your primary care doctor about it. If you don't have thyroid, certain thyroid diseases, and you're set up health-wise where you can lose some weight and it doesn't hurt you, and you start at the low dose and you work your way up, then I think it's been one of the best things of this country. Like I said, it's been the major cause in the last, 5 years of people losing a significant amount of weight and improving their health. And they keep coming out with better ones that have less side effects. But everybody who starts it, as far as I know that I've talked to, has GI problems.
When they start this shot?
Yeah, whether it's Ozempic or Mounjaro or any of the others of them, constipation, diarrhea, nausea, and this is where it's kind of like no pain, no gain. So you got to kind of suffer through that as best you can. And then after a few months, those symptoms pretty much go away.
Not bad. All right.
Maybe just once in a while, but the benefits are so worth it.
And here is another one. It's let me find where it was now. Give me just to say. It talked about how you talk about cataracts and cataract surgery and procedures a lot, but it asked a question, if I can find it again. And it asked about, let me just try to remember. It was about cataracts and how far along surgery and procedures have come along for cataract issues over the years.
Yeah, so just a quick history, of cataract surgery. First started with the Egyptians, BC.
Wow.
I'm telling you, those Egyptians and the early Chinese, they were highly intelligent, highly accurate, both for medicine and engineers.
Interesting.
How did they get all those giant bricks of stone and everything to the pyramids and do those things?
Yeah.
So they figured that out. Did you ever hear that?
Oh, yeah. Yeah. I've heard about it. And I saw a video of somebody kind of portraying this is probably what they did.
Yeah. So they dug out canals and they flooded those from the sea, and then they shipped everything on really barges that they made. This was BC. Of course, everything was made by hand with very few tools and a lot of sweat, but no equity. But anyways, that's how they got it there. It's just amazing engineering, what they did back then. And so anyways, maybe that's how they did Easter Island too. But anyways, just amazing. So if you have an issue back then with cataract surgery and you couldn't see, they took a very thin, sharp stick and they poked it through your eye.
Ow.
And they jabbed that cataract and they moved it out of the line of sight where it would kind of roll around on the inside of your eye. Hopefully you're not eating breakfast. Roll around on the inside of the eye, but it was out of your vision. Now, everything was blurry, but you could see doorways and you could see light, and you could barely get around, where before you couldn't do anything at all. Your world was blackness. And that's called couching. If you want to Google that, you can Google it. But couching. And then it wasn't until, the Second World War, Harold Ridley, who has since passed, but he was knighted by England's Sir Harold Ridley because of his work in cataract surgery lens implants. And he found out that the fighter pilots coming back that survived but got shot at and ended up with parts of the canopy, which were made out of plastic then, in their eyes, that there wasn't much inflammation. That it was there and it hurt like heck, but they take it out and sew it up and heals, but there wasn't much inflammation from it. And that material was relatively inert to the eye, and that they could grind that just like they do with glasses to make lenses, but make little micro ones they can put inside your eye. And those were the first lens implants. And everybody, just like they did to Einstein, called him an idiot, and he didn't know what he was talking about. And now, just in the U.S., there's going to be over 4 million cataract surgeries this year, 2025, just in our country, 4 million. Man. So it's only behind coronary stents, that you get for your heart to improve blood flow. That's number one. Cataract's number two. So the most common charges to Medicare. But anyways, cataract surgery then, until about the 80s, they'd make a cut across the surface of your eye, the clear part, the cornea. They'd flap it over. It's called an open sky technique. And they'd take a little spoon and they'd scoop the lens, the cataract, out of the eye, and then they'd flap it back. And you'd stay in the hospital for 2 weeks on a bedpan, couldn't get up, with sandbags on each side of your head. I'm not making this up. Maybe somebody who has a great-grandparent that went through it may know this. But you did that for 2 weeks to allow the cornea to kind of heal down to the sclera, to the rest of the eye.
Wow.
So it was a humongous big deal. And you only did it for the worst cataracts there were,
Yeah.
And it had a high-risk surgery. And it was a huge incision, all this kind of thing. And then in about the late 70s, early 80s, then we started to make incisions that were about 6.5 millimeters, much smaller than the 16 millimeter incision that was made before. And we put cataracts in, and they came in like a saucer, like a plate. And we'd still squeeze the cataract out of the eye, and we put this lens in. And so it was a smaller incision. And then we started to have sutures that the eye could take without much inflammation. It was catgut. And then, just like everything else in medicine, over time, the incisions got smaller. And the big break was when we came up with these foldable silicone lenses that you could fold in half. So now instead of 6 or 7, it was a 3 millimeter incision. Well, that made a big deal. People stayed in the hospital a night or so, and then they went home. And then we got to where they could go home a few hours later. And now if you have cataract surgery, the incisions I make are 2.2 millimeters, smaller than 1/10 of an inch wide. And boy, you only spend about 10-15 minutes where they get you out of the surgery center, So it's been a great improvement, both in infection rate and in comfort and healing, and importantly in the vision that people have. And now we have lens implants that are multi-powered so that people can see in the distance, see up close to read, and in between without glasses, which is something we specialize in, the full range vision lenses. So, yeah, come around a lot.
It sounds like it, yeah. This next question, do you have any memorable success stories where restoring someone's vision changed their life?
Oh, wow. That is so good. I'll tell you a couple jokes people have told me about a 89, 91, somewhere in there, year-old man who had cataract surgery, couldn't see very well, did his cataracts, come back, he's all healed up. And I said, well, sir, are you happy with your vision? How's your sight? Are you seeing pretty well now? And he said, Doc, let me tell you, those young ladies better be wearing lead aprons. So, you hear that from someone like that, it just makes you laugh. But, yeah, and, stories of people saying, I used to wear this beautiful lavender dress to church each Sunday, and I have my cataract surgery, and I find out it's this god-awful, tacky purple color, and, a lady said, I love my dog. It's a beautiful dog. And the sisters are there, and they say, Doc, that's the ugliest dog you've ever seen. She really needs cataract surgery. And then she has cataract surgery. She comes back in. I said, are you happy with her vision? She says, Doc, let me tell you, I do have an ugly dog. But I love that dog. That dog's so good to me. I love that dog. So all these kind of funny stories like that. But we have ones where people start driving again. People can see their kids and their grandkids play ball or on the stage or all the things that they do, and that just means the world to them. I had one lady once, she was a cancer survivor, but she said, the doctors have only given me 2 years to live. And I said, well, don't you want to just go get a fishing pole and enjoy life, for the last 2 years? And she said to me, if I could just see my grandkids' faces, that would mean everything to me.
And so she was able to.
Yeah. People go back to work. They perform better at work. They perform better at sports. All these kind of things that can help. Your vision's the most important thing you got, of your senses. And there isn't anything you don't do without your eyes. So you perform better, you feel healthier, you feel younger, all these kind of things. It affects your emotional state. People with Parkinson's and Alzheimer's come see me, and they're less of a fall risk. So all these kind of practical things too. And, cataract surgery is the safest, best surgery of all the surgeries you could go through for major surgeries. But they're not perfect. I don't want to gloss over it either. If you have a problem, I tell people it's like airline travel is the safest travel you can do. Yeah. But there's no fender benders. So, greater than 95% of the time, people are so happy they had it done. And we do everything we can to prevent infection and other problems. But as good as it is, it's not 100%. But definitely for the vast majority of the people that get it done, it has made a big difference in their life.
Well, this next question here is interesting because recently, I know the county schools for sure have cut out cell phone usage by the students in the classrooms. And I'm curious, by the end of the school year, I wonder what that outcome is going to equal as far as, did it really provide for better test scores and so forth. But this question is asking about, are you seeing an increase in younger patients who need glasses or some types of treatment because of screen time?
Well, there has been, several studies done on that have shown that a lot of reading up close when you're developing in the early years can lead to what's called progressive myopia, which means you get more nearsighted, which would mean you need a change in your glasses and such. So all kids going through school, every couple years, they should have their eyes checked to see if glasses wouldn't help them. And if their, grades aren't top mark and they're trying and, they're struggling or their grades are dropping, that's definitely something you should get checked out if you have it.
Yeah. And so constantly looking at that screen on your phone, is that truly bad for you?
Well, just during development, it can lead to, like I said, being more nearsighted.
Okay.
Now, if you're farsighted, it's a good thing because it brings you more towards neutral. But so it depends. And then for everyone past the age of, say, 15, then all of us now spend twice as much time, at least, on these video display screens than we used to when we were young. That's just a fact. Some people even more. But if you have that, then you're more likely to have eye strain. You're more likely to have a dry eye problem. Because when we focus on things up close, we don't blink as much. Only half the blink rate is normal. And that causes the eyes to be drier because blinking remoisturizes the eyes. So you should use some artificial teardrops. You should obey the 20-20-20 rule. Well, what's that? Well, that means every 20 minutes you're staring at a video display screen. You should look up for 20 seconds, focus on something at least 20 feet away to relax your eyes. The 20-20-20 rule.
Interesting. Again, Dr. Craig McCabe is in studio with us this morning from McCabe Vision Center, and his address, by the way, Heritage Park Drive. That's where you're located. That's right off of what, Memorial?
Memorial and Heritage. You know, there's a Truist Bank, there's Oscar's Tacos, there's a KFC right there up Memorial, and we're the next building off the corner.
So eat some lunch, then see Dr. McCabe, or do the other way around. I don't know.
Yeah, whatever you like.
We got to take a short break, and then we will be right back. Again, Dr. Craig McCabe in studio. Call us or text us at 615-893-1450.
WGNS is powered by Middle Tennessee Electric. MTE's EV Ready program provides members with $50 in bill credits toward the installation of wiring to support 240-volt charging in their garages. Learn more at driveev.com.
This is Peter Demas, and our family is inviting your family to come eat with us at Demas's Restaurant. Demas's has had a bar when we opened 35 years ago. And we've done the exact same thing with our bar menu that we've done with our food menu. We get higher quality items, higher quality cocktails. Again, some people just want a drink with their meal, where they might be able to get a drink to complement their meals. You need to check it out, so come on over right now. Demas's Restaurant on Northwest Broad Street. We really focus on value.
Hey, this is Dan with Music World and Drummers Den. Come in for your guitars, keyboards, drums. We have you covered. Our prices will normally meet internet prices. We also have PA and DJ equipment. Some lights, yes, we have that covered too. You can come rent a PA and sound system, do your karaoke, and bring it back. Come see us at Music World and Drummers Den, the one-stop shop where you have everything that you might need. 2762 South Church Street, right across from the golf course.
It's time to dig through the trash the right way. Here's Rocky the Raccoon with today's Recycled Minute, courtesy of RecycleRightTN.com.
Hey neighbors, it's Rocky the Raccoon. Here's another idea on what you could do with all those plastic bottles you go through for drinking water. You could create an outdoor bowling set for the kids. You take 10 bottles or so and you fill them up with water or sand. Then you line them up in the driveway, give the kids a ball, and let them roll them right towards those water bottles. It's low-cost family fun that reuses plastic bottles and keeps little recyclers smiling. For RecycleRightTN.com, I'm Rocky the Raccoon.
And that's today's Recycled Minute with Rocky the Raccoon. Find the closest place to recycle near you by going to RecycleRightTN.com.
Donating is easy at America's Thrift Stores. They're proud to partner with Make-A-Wish Middle Tennessee to help grant life-changing wishes for local children battling critical illnesses. When you donate gently used clothing and household items, you're giving more than stuff. You're giving hope. Every donation helps Make-A-Wish bring joy to a child right here in Middle Tennessee. Drop off donations today at the new location in Murfreesboro at the corner of Middle Tennessee and MLK Jr. Boulevard. Learn more at americasthrift.com/Murfreesboro.
We're talking with Peggy Parton. What have you enjoyed most about Adams Place?
The wonderful people that are here, and certainly all of those that take care of us and guide us, and they have something going all the time, and it's delightful. And the security that you feel here, it's wonderful.
This is Terry Deal. Come tour Adams Place and discover living a dream in your senior years.
The Action Line on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Again, Dr. Craig McCabe in studio with us this morning. You can call or text us with any questions related to the eyes. 615-893-1450. And we had a question earlier asking about, what inspired you to specialize in the eyes?
Oh, God, this is a long story, but I'll give you the brief of it, is that I never wanted to be an eye doctor. I was always going to be a brain surgeon, a neurosurgeon. And I have a PhD in neurosciences and regeneration of the central nervous system. And this is what I was all set to do. And I did an MD and a PhD, both in Charleston, South Carolina. And after doing my rotation, I enjoyed the work that the neurosurgeons did, but they were all divorced, and they were the first ones in, they were the last ones out, and you had to work where you worked major trauma hospitals, to have a busy business, and it just wasn't quite the lifestyle I was looking for. So I went to my medical school dean and said, what do I do? And he said, well, I don't know, take this personality test. And I got this 99 question personality test that young doctors, in school can take, and it'll help guide them what their personality best fits. And mine came out ophthalmology. I said, wow, I only had like 2 or 3 days of ophthalmology training in all of medical school. They kind of glance over. It's not much. And when it's the diabetic thing or glaucoma, that's about it. But so then, how many of your doctors that you see actually look into your eyes, right?
Yeah.
Like zero.
You're
so
right.
They send you the eye doctor.
Yeah.
So anyways, I went into it, and those doctors were happy, and they didn't have that kind of situation and had a better lifestyle. And, they told me, look, you got the grades, you can go into whatever you want. And I said, yeah, I don't want to go into it. I took a test, and he said, well, go do a clinical and a research rotation, because I had a PhD. And I published 3 papers, and I worked with some of the best doctors in the country. I was very fortunate to be where I was, that they had Storm Eye Center in Charleston, South Carolina, Medical University of South Carolina, very good training, and so I enjoyed it. And so I went with that, and I matched here at Vanderbilt, and I went to Vanderbilt Eye Institute for my both internship in internal medicine and residency in ophthalmology. And I've really, really enjoyed it, and I look forward every morning. It sounds corny, and I'm telling you it's true. I look forward to going to work. I enjoy what I do. Ophthalmology, it's one of the few medical practices where you don't say, oh, it's because you're getting older. I hate that reason, because that's not a reason. The reason is there's some disease process going on. But anyways, I enjoy it, and to make people better and to make them feel younger and see younger. How many of your doctors can you go to that you feel younger and, you get a lot more of your life back? So really enjoy it, very rewarding, and feel very fortunate to do what I do.
I know we've talked about this before, but I think a lot of people take the eyes for granted until they have a problem.
Absolutely. And then they realize it's critical to every single thing they do.
Yeah.
You know what I mean? They had a ladies' journal or whatever survey article that they sent out several years ago, and people said they'd rather lose both their legs than to lose their eyes, lose their vision.
Yeah.
So you think about that. Oh my gosh. But I really enjoy what I do. And you know what? Now I've spread out where I also do cosmetics, which a lot of people don't know, but we have a facial skin center at our office where we have all the best MD grade cosmeceuticals, the MD grade chemical peels, Botox, fillers, intense pulse light which takes care of red and brown spots on the face, and radio frequency microneedling, which builds back the collagen and elastin in your skin to get rid of wrinkles and make your skin thicker, not so paper thin like it gets when you get older. And, one of the things I've been doing a lot lately now, you asked me that as I came in this morning, is that we're doing a lot of dry eye treatments with radio frequency heating, which heats up the oil glands in the eyelids to 110 degrees for 10 minutes. And then I express all the bad oil out. And then it refills over the next week or two with healthy, thin oil. And that is the gold standard, best treatment for dry eyes, because most of dry eyes is caused by an oil gland problem. Which the oil coat sits on top of the water coat of the tear film and keeps it from evaporating. You know how oil sits on top of water?
Yeah.
And without that oil coat, the water can evaporate and you get a much worse dry eye problem. So we've been doing that more recently and had good results with that. So if you have dry eyes and you've tried other things and you're struggling, consider that. Give us a call.
Again, Dr. Craig McCabe in studio with us today. Have another question here, and this one asks, what's something about eye health that most people get wrong or misunderstand?
Wow, these are like really thoughtful questions.
People are getting more intelligent.
Your listeners are getting so much more intelligent. Yeah, so, well, we talked about, first of all, just going to see the eye doctor. That's probably the biggest thing. Thinking that, I can see okay, they don't hurt me, my eyes are fine. You can't see glaucoma till you got tunnel vision, till it's way too late, and then it's not treatable. The retina and the optic nerve are part of the brain, the central nervous system, the brain and the spinal cord, and those parts can't be replaced, and they don't regenerate, and they don't heal. So that's why you have to take care of them before damage happens or at the first sign of it. And the doctor can tell the first sign. You can't. So I'd say that's number one.
Am I mistaken? Are they finding a lot more diseases and problems that have to deal directly with the central nervous system now than ever before?
Oh, yeah. We're much better at diagnosing many things. And we have better blood work tests. We have better imaging for MRIs. They're stronger magnets. And we're a lot more attentive of what to look for, too. Pediatricians, let's put a shout out to them. It didn't used to be that they could do much of an eye exam, and now they do, and they catch lots of childhood eye diseases first, where before it would go to the ophthalmologist, but too late. And so, yes, there's a lot of benefit there. Let's see, another one that they may not realize. Well, I see so much dry eyes. We really treat a lot of dry eyes, and a lot of people think that they just have to suffer through it. And you don't. We've got good treatments for. You start with the over-the-counter eye drops, so we've got tear duct plugs. We now have, for people that are diabetics or long-time dry eyes or other issues, we have liquid in a bottle for teardrops, nerve growth factor, to help the nerves go back into your eyes. We have just a lot of good things to help people out. And what I would say is, if you're having problem with something, and go see the doctor. If that doctor can't help you, go get a second opinion, and do whatever you can to maintain your health as good as you can.
And this one may end up being our last question of the morning, but it was saying that their eye doctor recommended lens implants, and they recommended premium lens implants, and they're asking if this is a real thing, or is this just an upsell the doctor is trying to do. Premium lens implants versus regular lens implants.
Yeah, so let's talk about that real quickly for a minute. Your insurance, Medicare, a Medicare substitute, what have you, commercial, they will pay for the standard lens implant, which we've used for a couple of decades. It has one power just for distance. You won't be able to read with it. You won't be able to see up close. Your distance vision will be improved, but you'll likely need to wear glasses. High percentage. Then we have ones that correct astigmatism. 50% of the population has significant astigmatism. And if you get a treatment done for that, then your chances of only needing reading glasses and not distance vision, or both, called bifocals, is much better. And reading glasses are much less expensive, so that typically pays for itself. And then we have multifocal or full range visions lenses, like I was saying, that are either non-astigmatism correcting or also astigmatism correcting. And if you're a good candidate for that, and only your doctor can determine that, your surgeon, if you're a good candidate for that, then you can have one of these advanced premium or full range vision lens implants. And that really takes away the need for glasses near and far in almost, most situations that you'll have during the day. Those are our happiest patients. That's another thing we specialize in. If you're looking to see without glasses, we'd love to help you.
Again, Dr. Craig McCabe from McCabe Vision Center. Stay with us. Local news is next on WGNS Murfreesboro.